Okay. Good afternoon, everybody. Thank you for taking time out of your daily schedule to come down here and sit with us and have a conversation, in essence, to talk about Medicare 101, or I like to call learn about the ABCs of Medicare. My name is Mike Conlon. I am your representative from Aetna. I work with Lena on a regular basis. I brought with me today the resident expert of Aetna. She is the head of Medicare for the state of New York with Aetna. Her name is Jennifer Neary. Thank you for joining us, Jennifer.
Hello.
And really what we would like to do, and honestly, I've been in the industry 25 years. I'm learning something every day. Going through this whole process of going through the ABCs of Medicare, my goodness, I just learned so much in the last hour. So what I'm hoping is that everybody in here and on the phone will have takeaways that they can, learn more about Medicare, A, B, Part C, Part D, et cetera. So with that, what I would like to do is hand it off to Jennifer, and what we're going to do is we're going to walk through a presentation. I ask that we hold most of the questions till the end. I'm going to ask some questions intermittently, but we would also like that if you're asking a question here in the room, that we bring you the microphone so that the people on the phone can actually hear the question. Okay? Thank you very much.
Okay, so thank you, Mike. Thank you all for being here. I was just kind of listening a little bit throughout the room, and I heard, some people say, hey, I'm here for my parents. I've done this for my parents before. Medicare can be a very confusing time for everyone. The coverages can be confusing. Understanding the terminologies can be confusing. I mentioned in the earlier session that, anytime we have a government program, I think that they're not designed to be as simple as they possibly can for us sometimes. So we're here today just to kind of walk you through some of the basics. And then, just to let you know that if you are interested or if you have someone in your family or friends that you think may benefit from sitting down and doing a one-on-one presentation, we can certainly offer you those services as well. So here's our agenda. We're going to go over 6 things. We're going to go over the Medicare Parts A, B, C, and D and kind of explain what those are. We're going to go over what government and private plans are, what some of your options are. We're going to talk about prescription drugs. We're going to talk about medical supplemental insurance, which is going to be very different from the MAPD plans that we talk about, and then what the next steps would be if you were ready to enroll or someone in your family was ready to enroll, what they needed to do next. Okay, so important to know, I'm sure, and I mentioned earlier too, that this time of year you'll really start to hear a lot about Medicare. You'll see things on TV, some of those late night infomercials. They'll do half-hour kind of infomercials trying to go over some of these concepts too. Your mailboxes will start to get bombarded this time of year. Medicare has 4 different parts, so you'll hear those things or you'll see those things on some of the literature that you receive, A, B, C, and D, and we'll kind of discuss what each one of those is. So Medicare Part A is what we call original Medicare. A and B are going to be called original Medicare, okay? Medicare Part A covers hospitalization services only, okay? Medicare Part B is also part of what we call original Medicare, and Medicare Part B is going to cover your medical services, so doctor's visits, your primary care physician visits, your specialist visits, things like that are all going to be covered under Medicare Part B. So we have A, hospitalization, B, doctor's visits. And again, the 2 of these combined are what you'll hear called original Medicare. So if someone says to you, oh, I have original Medicare, that's what they're talking about. They've got Medicare Part A and Medicare Part B. Both of these parts are administered and provided by the federal government. So if you sign up for Medicare Part A and B, you're getting the coverage directly through the government. Who's eligible for Medicare Parts A and B? So people that are 65 years and older, people that are under 65 with certain disabilities. So if you're disabled for 24 months or longer, you can be eligible for Medicare. And people of any age with ESRD, end-stage renal disease. Then we have what we call Medicare Part C, okay? Medicare Part C is called Medicare Advantage. You'll hear it called MA for short sometimes, or you'll hear MAPD. That's Medicare Part C.
So Medicare Part C is really private A and B.
It is. If we go to that, yes, if we go to the next slide, if you would, you're going to see that you purchased your Medicare Part C through private insurance companies. So Medicare A and B, that's through the federal government. Medicare Part C is through private insurance companies. Okay? Medicare Part C, which you purchase through the private companies, it combines Medicare Parts A and B. So if you purchase a Part C plan, you're going to get your hospitalization, you're going to get your doctor's visits. You're also going to get some additional things that original Medicare does not cover. Not all plans cover all of these things, but you'll find that most of them do. So you can have eye care, hearing, wellness services. We even have, and we didn't mention this in the last group, a lot of them will even cover like fitness facilities. So you get a free fitness benefit to your local gym with a lot of the Medicare Part C plans. None of that you will get when you just have original Medicare. So you can purchase the Medicare Part C plan, but some of the criteria to do that are you must be enrolled in Parts A and Part B. In order to be eligible for C, you have to have enrolled in Parts A and B, okay? You have to live in the plan service area. So the plans that are available to you are based on the county that you live in. And you cannot have end-stage renal disease to have Part C. It would exclude you. It's the only disease out there that's excluded for this plan. There's other plans that would cover that. Then you'll hear Medicare Part D. Do you have your Part D? Part D is prescription drug coverage. So in your original Medicare, if you have A and B, none of your prescriptions are ever going to be covered. There is no coverage for drugs. You would have to purchase a Part D plan. Okay, and we're going to talk a little bit more about Part D in depth a little bit later. And again, only offered through private insurance companies. So you cannot purchase a prescription drug plan through the government. You have to purchase them through a private insurance company. So those, just to recap again, the 4 parts, A and B are your government program parts. Part C is your private medical plan, and then Part D is your drug plan. That's okay. Okay, so government and private plans. Why can't I just rely on Parts A and B, what the government pays for? We're gonna talk about that. You can just purchase, or you can just sign up for Part A and Part B, but what's going to happen is it's only going to cover 80% of your medical costs. So the government plans are designed to cover 80% of what your hospitalization bill would be, what your doctor bill would be. You're going to be, as we say, on the hook for 20% of the bill if you do not have a supplemental or a Part C plan. So Part C, it's called a Medicare Advantage plan. You'll hear it MA plan, or many times you'll hear MAPD, because Part C can encompass your Part D as well. If you have an MAPD plan, that means you have Medicare A, B, C, and D. It's all in one, okay? And it's going to help you cover costs like deductibles, co-pays and co-insurance, most of your drugs, preventative services, and again, some of those plans offer additional things like you might have dental, vision, hearing aids, things like that on a Medicare Advantage plan, on a Part C plan. So they say, what's the bottom line? Part C, or Medicare Advantage, helps you pay for what original Medicare does not. So the 20% that's kind of left out there when you only have Medicare Part A and Part B is what Part C is going to help you pay for, okay? Lots of choices, again, you'll see in the marketplace. You're going to see lots of things in your mailbox, lots of commercials, lots of advertising this time of year telling you what your options are. So how do you decide which Medicare plan is right for you? Here's some questions that you want to consider. Do you have a chronic condition? So you'll hear, you know, and the health insurance business is filled with acronyms. We always have lots of acronyms. You'll hear something called a SNP plan, an SNP plan. It stands for a special needs plan. So if you do have a chronic condition, many times there are plans available to you that are at a zero premium plan, and a SNP plan or a special needs plan will always include your drugs. So if you're eligible for, if you have a chronic condition and you have a special needs, you'll have your drugs included in that plan. Also, what monthly premium can you afford? So, exactly, yeah. There are lots of zero premium options out there. You'll also see some plans that do have a premium. So some plans will be $79, some plans will be $100, some plans will be $29. Depends on the county that you live in, okay, on what's going to be available to you. And what's always very important too, what doctors do you want to see? So, you know, you want to really consider that. Is my doctor in the network? And with our Aetna plans, we have a very large national network, specifically in this area, very, very strong network. But you want to make sure before you sign up for one of these plans that you can see the doctors that you want to see.
So Lena brought up a good point earlier about zero premium plans. Yeah. So the zero premium plans are in certain areas of the country, like you said, Sussex County?
Yep, so we have one in Suffolk County and yep, Suffolk and then Nassau County. We have a zero premium plan for 2017 that's going to be available.
Now you might hear zero premium plan and think it doesn't cover anything, but the reality is from the government having collected Social Security for years, they actually put money in for certain areas of the country to pay for these plans.
That's right. So depending on the county that you live in, the government reimburses the insurance companies. That's where the premium is paid. So, you know, don't think, oh, zero premium, it seems too good to be true. What am I really getting for that? No, you've actually paid for that. All these years that you've had, you know, money taken out of your checks to pay for this coverage, that's where that premium is being subsidized now. The government's now giving that back to pay for your coverage. And in some areas it's zero. Some areas, again, you'll see $29, $79, depending on the plan that you choose.
And the reason I mention it is because I've been in this business for 25 years, and I just learned that today. So you learn something new every day, and I wanted to share that.
And what about your prescription drugs? So, I mean, we all watch the news. We see these pharmaceutical companies, the pricing of drugs. I mean, we just saw the other day, it was the EpiPen that went from...
skyrocketed, right? Terrible.
Can you imagine, though, needing that and not having any drug coverage? You have to pay $600 for... You have...
Right.
So if you don't have a prescription drug plan, if you only have original Medicare, something like that is not covered at all. You have no coverage, that has to come out of your pocket, and those are things that you need. Or anyone that has, you know, maintenance medications for, you know, diabetes or any kind of maintenance type condition you might have, you'd have no coverage if you didn't choose an MAPD plan or a PDP plan. What is your out-of-pocket cost going to be? So obviously, I mean, you know, we all have budgets. None of us are winning the lottery every day, so, you know, what's that going to cost me every year? What happens if this happens? These are all the things you just want to think about. And, you know, what pharmacies do you want to use? Some people are very particular. They want their Walgreens or they want their CVS. You know, not all plans cover all pharmacies, so it's kind of something to really think about. So you have two paths to choose from, okay? If you decide you just want to go with Medicare, original Medicare, you're going to get your Medicare Part A, you're going to get your Medicare Part B, okay? You're going to pay a premium, $121 a month currently is what it's at for your Medicare Part B premium. But then if you want drugs to be covered, you have to purchase a separate, what we call PDP, prescription drug plan. Okay? You can also purchase a supplemental insurance plan that's going to cover that 20%. So you'll hear things, you'll hear the word Medicare Sup, or you'll hear Medigap plans, okay? That's a special kind of additional coverage that you would want to purchase if you just had Medicare, original Medicare only, because you wouldn't have coverage for your drugs and you'd still be on the hook for that 20% that original Medicare is not covering, okay? The other option is to choose a Medicare Advantage plan. That combines your Medicare Part A and Part B, Okay, it usually includes a drug plan. In New York, our Aetna plans all include drug plans, so we only have MAPD plans available. You can certainly purchase with, some of the other carriers, you can purchase a Part D plan, but you have to pay an additional premium if you purchase a separate drug plan. Okay. If you choose Medicare Advantage, on this slide it's going to tell us that we have two options. There are actually several different kinds of options out there. These are a couple that we're going to talk about today, though. So an HMO, Health Maintenance Organization, it's an in-network only coverage. So if you wanted to go out of the network, if you wanted to go to Florida for 3 months, you would only have emergency coverage. You wouldn't have any coverage using a regular HMO, except with the Aetna plans, because we have an open access plan. So if you were to take an HMO plan with Aetna, you could go Florida, Texas, wherever you wanted to go, wherever we have a network. But it's important to know that not all plans work that way. So if you do look at other HMO plans, it's important to know that there is no out-of-network coverage unless it's an emergency. Or you'll see PPO, Preferred Provider Organization. This gives you coverage in and out of the network. So if you wanted to go see a doctor that happened to not be in our network, you would still have coverage for that. You'll also hear POS, or point of service. Those plans are kind of making a comeback now in Medicare. We haven't had them for many years, but they're kind of making a comeback now. So you may see that on TV or read about it in the mail. A point of service is similar to, it's a kind of a combination of a PPO HMO. So you do have out-of-network coverage, but many times you have a referral.
You have open access managed choice as an active employee. Is that what you? Right. It's the same thing as a point of service plan.
Yeah.
You have in and out of network options. Yeah. And that's really what you have. Right. It's in and out of network options. Right.
No, and most Aetna plans don't. That's one of the things to know about the Aetna Medicare Advantage plans that we have in New York. No referrals. No, some of our competitors, or even in other states, they have that. But one of the nice things about purchasing your plan and living here in New York, no referrals.
One thing I want to mention, if I didn't mention it in my introduction, was Jennifer manages a team that can actually assist people individually or collectively as a group. They can have people come to this location. She's going to hand out some information at the end in terms of a business card, and she could help coordinate having somebody meet with you. I think ultimately that's what we wanted to share with you about the Medicare Advantage plan if you so chose not to go the Part A, Part B direction, and you wanted, greater coverage through Medicare Advantage.
Absolutely. So again, this just kind of talks about what we had just said. With the HMO, you use the doctors in the network. You may need a referral for a specialist. And with the PPO, you have out-of-network coverage as well.
So locally, I think you said HMO would be Manhattan only?
Yeah, Manhattan, Queens, Brooklyn, we have an HMO. Here in Suffolk and Nassau and Suffolk County, only PPO plans available, which zero premium PPO, you really can't beat that. No. Let's look at what Medicare Advantage plan can help you pay for and what original Medicare does not pay for. So Mike likes this slide.
Favorite slide, because it helps me understand Part A, you have to pay a deductible. Part B, you have to pay a deductible. So if you elect, you automatically get A. You elect B, which you have to pay for monthly. You would get a supplemental plan potentially that could help you pay these dollars that are out of pocket.
That's right. So again, if you're only on original Medicare, this still has to come out of your pocket. You still have to pay for these things, okay? The Medicare Advantage plans can help you fill in all those gaps and help you pay for those coverages that you're kind of left out there to pay for.
So you want us to wait till the end to ask a billion questions?
If you don't mind, unless it's... Okay.
That's all right.
No, if you have one now,
if you have one
we'll just get you
here.
a microphone.
Could you go back just 1 second?
Sure. And this will be available on your website too, this presentation too.
So quickly, I know I don't want to do that, but I'm trying to write down questions, and I know we're going to forget. I personally just went through this with my mother-in-law, and we did have to pay because she didn't get into a plan. That's enough of that conversation. But anyway, when you say, so I didn't know that Aetna had a Medicare Advantage.
We do, yep.
I'm hearing that.
Yep.
Okay. So when you say help you to pay, that doesn't mean pay.
It depends on the plan, okay?
I see. So you have, so HMOs, I'm assuming, are cheaper.
Not necessarily, believe it or not.
But you get cheaper services.
Not necessarily.
Okay.
It depends on the plan. That's why I always recommend it's once a year, sit down with one of our what we call FSRs.
Yeah.
Sit down with them, have them go line by line, coverages. What are, what your mother-in-law's needs could be very different than what my mother-in-law's needs are.
Well, I learned a lot, but I was also heard so many things and read so many things that say never give up original Medicare. And I don't know why.
Well, and here's the thing. When you have C, you're not giving up original Medicare.
No, you have A and B also. I understand.
Yep, so you're never.
So I didn't get that whole thing reading, what that meant. But I don't want to keep going on.
Okay.
So it depends on the plan what they're going to help you pay for.
That's right, yep.
I'm assuming Part A deductible would be paid for.
Yes.
Most of them are like.
And your B deductible.
Right.
Yeah.
The ones.
Yep.
Yeah, I get that. So, okay.
So we'll take the 20% services, for example. So if you went to the doctor and your bill was, $200, if you only had original Medicare, you'd be on the hook for 20% of that.
That's right.
With a Medicare Advantage plan, you might have a $5 copay. So you'll still pay, you may pay something, but you're going to pay like $5 or $10 compared to, whatever that
And if
would
you
be.
had a Medicare Part C, the Medicare Advantage plan, should I assume that $166 a month would be gone?
No, that's a very good question. So you still have to pay, whether you have a supplement, have to pay your well, no, I'm sorry, not the deductible, but the premium. So the deductible would be gone, but you still have to pay a premium for Part B every month. That's $121 a month.
I see.
Regardless of whatever plan you take, you have to pay
but
the part.
It's still cheaper than $166.
Well,
wait a minute. You have to pay every month Part B if you have original Medicare.
Yes.
And that's?
It comes out of your Social Security check, usually $121 a month.
Right.
Yep.
So, and still then the Medicare Part C plan would still be the same premium or whatever.
If there was a premium, you would pay a premium for the Part C, but so in these counties it's a zero. So you're really only paying your Part B premium. You're not paying anything for Part C, and you're getting eyeglasses, hearing aids, fitness benefits, all these other, and only having to pay like a $5 copay for doctor services.
I think it's really going to be good to have individual help for a lot of people. Their needs might be.
I agree 100%.
Okay,
yes.
These amounts, are these based on Sorry, those amounts, are those for everybody in the country, or is this for New York?
It's a national, yes, these are national numbers, but they change. They'll change for 2017. So this is kind of giving you a 16, right, 17 could be different. We know that in a few weeks from now.
But you have to live in New York State.
You can get a Medicare, you can get an MAPD plan just about any place in the country. For our Aetna New York plans, yes, it goes by the county that you live in. Would be, so if you're in, Suffolk County, here's your options. If you're in Richmond County, we have options there. Yep, so it depends on what county you're in, what's available to you.
So you could have 2 options in one county and 4 in another.
Absolutely, yep, yeah. Okay.
So say if you live here now, you're 65, you buy a plan, and then you move. You have to get into another plan?
You do, and we're going to talk about that in a little bit. That's going to call a special election period where you can change your plan.
Okay.
Absolutely. Yep, no, that's fine.
Oh, great questions. Seriously.
So depending on the plan, Medicare Advantage, we kind of talked about some of these things already, but, annual hearing exams, emergency medical care outside the U.S. If you travel, you're going on cruises, you want to make sure you've got your coverage. Eyewear and hearing aids, prescription drugs, and then out-of-pocket medical costs, we were just talking about. We're going to take a little look here at prescription drugs now, or otherwise known as Part D. Okay, here's how Part D works. You buy this in addition to Part A and B. So again, if you only say, no, I'm going to stick with original Medicare, I've got all the money in the world, I don't care about paying 20% of my hospital bill, and now I'm going to purchase a Part D plan because it's not covered on original Medicare. So you can purchase a standalone PDP, or you can buy a Part C plan, a Medicare Advantage plan, that incorporates that Part D coverage. So again, all of the plans that Aetna offers in New York are MAPD plans. Your prescription drug plans are automatically included in that Part C plan.
So prescription drug is automatically included. I'm just reiterating what I just heard. They're automatically included in the Medicare Advantage plan.
In New York.
In New York.
Aetna, yep, Aetna Medicare.
It could be in a different area of the country where it's not included.
Yep, you could just have a Medicare Advantage plan and then you'd purchase a standalone PDP, or if you decide I want to go with a Medicare Supplement, you need to purchase a PDP plan, okay, because they're not included on supplement plans either.
I feel the same way. I completely understand. Honestly, because and that's why we're here. Because I had to break it down and silo it, and here's what I say. Medicare Part A, Part B, I get a supplemental plan to cover my deductibles for both. That's how I have to look at it. If I need prescription drug, I'm going to purchase a separate prescription drug plan, PDP, or I'm going to call Jennifer and her team, and I'm going to work with them to figure out a plan based on where I live that meets my needs, and elect to go Medicare Advantage route that includes a prescription drug plan, because those are the plans that are available in my area on Long Island.
That's right. Well, we're going to talk about annual enrollment period. It's coming up in a couple weeks. It's when you can make a change. Absolutely. So I'm sure you've all heard about the donut hole. I mean, we've heard this just in the news, or you hear people kind of talking about it. What is this, donut hole? We're going to show you step by step exactly how you get there and how you get out of there, okay? So here's how it works. There's 4 coverage levels, okay? When you sign up for your prescription drug plan, you're initially going to be in phase 1. You're going to pay out of your pocket until you reach that deductible, okay? And each plan can have a different deductible. It depends, again, on the plan you choose. Once you hit your deductible, you're in phase 2, okay? Your Part D insurance is going to pay until $3,310 in total. Part D drug spending is reached. So once you've reached $3,310, you're now in phase 3, or what we call the donut hole. Sometimes you'll hear it referred to as the coverage gap, okay? And again, we talked about how pricey those drugs can be. I have people that never hit the donut hole, and then I have people, like, by March that are already in the donut hole. Okay, and once you hit that donut hole, you have to reach into your pocket and pay out of your pocket until you hit $4,850. Okay. Once you've hit $4,850, you're going to pay the greater of 5%, or $2.95 for generic drugs, and $7.40 for all other drugs. Okay. Many of our MAPD plans take care of this for you. They have what we call coverage in the gap. Okay, so basically what happens is you'll have, instead of having to deal with all of this, you'll have a 5-tier system where you pay a certain amount for generics, a certain amount for preferred drugs, a certain amount for non-preferred, and they're co-pays. $5. Some of them are $1 for the generics. I've seen them as low as $1. Some of them are $5. This is a great question. So it would be a good idea to ask, as you're shopping around, what does the coverage cover? So one of the things you want to do is when you sit down to speak to someone, you have your list of medications ready, because they'll be able to tell you, they'll be able to pop it right into the system and say, this is exactly what your drug costs. If you just remained on these drugs this year, this is what it's going to cost you. So you want your prescriptions ready. You want to know, what level you're taking prescriptions.
So this is on an annual basis?
This is an annual basis.
So it depends on the plan that you have, what your deductible is?
Exactly, yes. The plans can vary in deductible. They can vary in copay.
This is buying private.
Yes. Well, there is no,
right.
Keep in mind, there is no, no government coverage for Part D.
I understand what you meant.
Yep.
Okay, so if you buy private, go the D way or go the C way, the D still works the same?
It does. So you want to sit with someone and say, is there coverage in the gap? Do I have coverage in the gap? That's one of the first things I always would want to look for if it was myself or my family. You know, make sure we've got coverage in the gap. What are our co-pays? How fast are we going to get there? What kind of medications are we taking? How fast are we going to get to that donut hole? And what happens when we get there?
So there's multiple prescription drug plans under Part D.
Absolutely.
It happens that this version of it has a $3,310.
No, that's going to be the national, so that is what the Medicare.
Okay, so that's the national.
It is, and that again changes every year too. So you want to kind of keep an eye on that because it'll change every year. Yes, we have a question in the back.
I just want to understand, when you get to phase 3, is that the donut hole or phase 4?
Phase 3 is the donut hole, yes.
So phase 3 is the difference between $48.50 and $33.10.
That's right.
So if you need EpiPens, your $300 generic EpiPen that was mentioned,
right,
it's going to be $300, accumulates to the $48.50. Then at that point, you pay 5%, greater of 5%, or $295 for generics.
That's right.
Okay, or $740 for other drugs.
You certainly can. Again, I have people, the coverage always begins on January 1st if you're going for an annual enrollment period. In like 90 days, they've hit that sometimes.
And if you're two people in a house, you're individual.
That's right. This is always individual. Medicare is always individual.
It's not a family
It's not a family coverage. It's not a husband-wife coverage. It's not, no, always individual.
That's why they ask you, do you have enough money to retire? The answer is no. You're on drug.
Okay.
I lost control.
Okay, so we're going to, now we were just talking about original Medicare and we talked about MAPD or Medicare Advantage plans. Now we're going to talk about Medicare Supplement plans. Okay, so again, we're going to give you two options. You can either go with original Medicare, where you get your Part A, your Part B. You would have to purchase a separate Part D plan, and then you would purchase a supplemental plan. Okay? Again, sometimes you'll hear MedSup, you'll hear Medigap. It helps to cover the gaps of what original Medicare does not cover, such as portions of coinsurance, copayments, and deductibles. So it works similar to an MAPD plan, but there is no prescription drugs. You have to purchase a separate prescription drug plan.
So it's A, B, and supplemental insurance.
A, B, and supplemental. Okay. Yep.
This is not supplemental there. Same thing, Medigap.
Yep. Okay, so the next step, step 1, to enroll in a Medicare Part A and Part B, when are you first eligible to enroll in an original Medicare? You have two ways to proceed. You can keep original Medicare, okay? And something I want to talk about, because we had touched on it in the earlier session too, keep in mind, while you're still working, while you're still actively working here, you know, you want to enroll in your Medicare Part A, but you do not necessarily have to enroll in Part B. You have what we call credible coverage through your employer right now, okay? Yes?
Does that include your spouse?
No, remember, this is always individual.
Insurance here at iPro, and my wife reaches Medicare age, she doesn't have to get Part B. She's covered by me.
That's right. That's right. So that's correct. If you still have, it's still considered credible coverage because your wife still has the credible coverage that you get from iPro. That's right. She doesn't have to pay for Part B until you decide to retire, and that's when. Okay, so again, you can keep original Medicare. You can add a Medicare supplement and pay a premium for that. Those premiums tend to be specific to this area. They tend to be about $137, $180, $200, and that's a monthly premium for a Medicare supplement plan. And then you would have to, in addition to that, purchase a Medicare Part D plan. Okay, so you have to purchase. Okay, we've got another question.
Exactly when do you have to apply for this? How old?
You have to be 65. Okay, you must be 65 in order to be eligible. We're going to go into what that eligibility period is, or disabled for 24 months or longer. Okay, and if we go to that next slide, now that I understand my Medicare options, when can I enroll? How do you enroll in Part A and Part B? If you're getting Social Security when you turn 65, you're automatically going to be enrolled in Part A. So in order to get the Social Security, though, you have to go down to the Social Security office, or we had someone earlier that said they did it online, and she said it was wonderful, she had no problems. So you can either go to your local Social Security office, or you can do it online. If you're not getting Social Security when you turn 65, you'll need to sign up, okay? You want to contact Social Security 3 months before you turn 65. Important to know, if you or your spouse have worked for the railroad, you must go to the Railroad Retirement Board to sign up for your benefits there. They will automatically send you right there.
So you're talking about two different things then. You're talking about Social Security and Medicare are two different.
They are two different things.
So if you're not getting Social Security
because you're still working,
or you haven't applied yet because you're waiting for a bigger number, you need to sign up.
You need to go to your local Social Security office to sign up, yes.
Right, but when you're talking about Medicare and Social Security, I don't get why they're together.
Because that's Social Security is going to help administer the paperwork for Medicare, for your original Medicare, okay? So suppose you started taking your Social Security at age 62. A lot of people kind of dip into it a little bit earlier. They start early, 62, 63. So if you're already getting Social Security when you turn 65, you're going to automatically be enrolled in Medicare Part A.
Okay, but if you're not.
But if you're not, if you've decided to wait so that you can get the bigger amount.
So you just have to, so then you would have to enroll yourself.
You would need
65 for Medicare.
That's right.
You're not automatically enrolled.
That's right.
For Medicare or Part C?
Part C is completely different.
You don't need to do that.
And we'll talk about that.
Okay.
Yep.
Now, all right.
But just from a personal perspective, I went through exactly this with my father. He started collecting Social Security when he was 62. Mm-hmm. He had to sign up for Part A and go to Social Security office for A, he automatically gets. Didn't realize he had to pay for B. He had to sign up for B, and I think that's $121
a month, yeah.
I went through the same exact thing with my dad.
Yeah.
Speaking of that 121, somebody on the WebEx asked, I was told that the 121 premium is income driven, and if your income is over a certain level, you will pay more. Is that true?
That is absolutely true. That is the average. $121 is the average. I want to say it's over, like, don't quote me off the top of my head because it's over like $300,000, you'd start to pay more, or $250,000. You start to pay more. So generally we say it's $121, yeah. I think it's a little bit higher, but okay. Okay, they can't hear. Let me get you a microphone. They can't hear you on the phone.
Medicare now starts at 65, but Social Security starts at 66 or later.
No, it can start earlier.
It can, but for full benefit, you start at 66 at, yeah.
Yep, so let's just keep in mind, Social Security is completely different than Medicare. Very, very different. That's right, unless you're disabled.
Right. So I brought up the 7-month
Yep.
window.
Okay, perfect. So when can you enroll in Part A and Part B? There's a 7-month window. So it includes 3 months before you turn 65, your actual birthday month, and then 3 months after you turn 65. That's going to be the time period when you want to consider signing up. My personal opinion is always earlier is better. You know, why wait till, yeah. Oh. Yep, yep. Yep.
Through IPO.
That's right.
No.
That's
So
right.
Just A.
It's just
So
A.
what?
Yep. What happens if you don't enroll when you're first eligible? So suppose you decided to retire and you didn't go sign up for your Part B, you're going to have to pay a penalty. Okay, they will charge you a penalty in the form of a higher premium. So
I didn't even know that. I thought it was like a one-time penalty. It's you perpetually pay the higher premium.
you do, and especially with Part D. So we'll get into that with the drugs. If you didn't, it's for every month that you were eligible with Part D. They charge you that premium. Yeah. When can you first enroll in a Medicare Advantage, the Part C plan? It's the same 7-month window as Part B. So if, let's say, you turn 65, you're retiring at that time, you're going to want to sign up for your Medicare Part A and B, and then you're eligible to sign up for Part C at that time as well. Okay? And the same with D.
But if you're not working and you don't have that coverage anymore, isn't it a 6-month hurry up and get into one of these plans?
You have a
then you get, is it 6 months?
3 months.
3 months.
Yep. So you really want to do it as soon as you know you're going to retire. Again, get down to Social Security, make sure you sign up at that time. Yep.
Yeah, but
I would do it before. I had someone here before that said that she had tried to do that, and they sent her back and said, no, come back when you're 30 days closer, but it kind of depends on who you get.
But you don't enroll through Social Security. See, that the whole Social Security and Medicare gets...
Social Security is just the office that you're going to go to sign up for your Medicare. It has nothing to do with your Social Security benefits.
You can't get C and D through Medicare.
No, that you're going to purchase through a private insurance company like Aetna. Yep.
You're not going down there.
You're going down there to get your A and B, because you can't purchase your C without your A and B. Yep.
Well, you know, I mean, when you think about it, it's a big baby boom.
10,000 people a day in this country are turning 65. That's why I have a job. Okay. Are there other times that I can enroll in Parts C and D? So from October 15th through December 7th, so as I mentioned earlier, you're starting to be bombarded with mailings and commercials and all kinds of good things like that. That's called our AEP, or Annual Enrollment Period. So that's the one time of the year that you can make a choice on whatever Medicare Advantage plan you'd like to have. You're going to wait till right around that time, look at your options, and then make a decision from there. You can switch to Medicare Advantage during open enrollment, or you can join a Medicare prescription drug plan during that time. So if you only have if you have Medicare A and B, that's the time to pick your drug plan too. It's always done on that annual basis. You can also enroll in Part C and D during a special enrollment period, okay? Some of those things are, you lose your employer coverage, so you decide to retire. That's going to be what we call an SEP, or special enrollment period. If you decide, I'm going to move to Connecticut, okay? That's going to be a time for you to change your plan. You'll have time to choose a different plan. Being assigned to a Medicare prescription drug plan by the government. So it's when the government decides to pull plans, they can certainly, you know, you're eligible to change your coverage at that time. I think we've got a question in the back.
If you're not going to make any changes during the open enrollment period, you don't have to do anything.
You do not have to do anything. You'll get something in the mail called an ANOC, an Annual Notice of Coverage. That's usually mailed out to you around the 3rd week in September to be in your mailbox by October 1st. and it's going to explain to you what the coverage changes are for the year. So generally, you're not going to see everything stay the same. It's kind of like your insurance here. You know, your copay might go up a little bit. In some cases here in Long Island, our premiums came down. They were $134. They're down to $79 on one particular plan that we have. So, you know, some of the doctors' copays came down. You don't see that happen very often, but it's nice when it does. But yes, you're absolutely right. So if you get that notice of change or notice of coverage in the mail, and you say, yeah, I'm happy with my plan, I'm not paying anything for a premium, this is great, you do nothing. You just stay with it.
You had mentioned about the penalty. Could you explain the penalty again?
Sure. So if you do not sign up for Part B or Part D when you're first eligible, so depending on your circumstances, if you decide to retire at 65 and that's when, you know, you're going to sign up. If you choose not to sign up for Part B at that time, you can be penalized. They will charge you a higher premium for your Part B than what everybody else has to pay. If you don't sign up for your Part D, your prescription drug plan, when you're eligible to do so, they can charge you a percentage, and I say can, they will charge you a percentage, per month. For every month that you were eligible and did not sign up for that, you'll be penalized, and you have to pay that penalty for the rest of your life. It doesn't go away. It's not a one-time shot. So you want to really be careful, and this is why we do these education sessions, to know if you're eligible at that time, you want to make sure that you do that so you're not penalized. And I've seen bills, I mean, and it's monthly. Here's what your premium is, and now here's your penalty premium, and it's listed on your bill separately. Here's your penalty.
But if you have credible insurance through your company, you wouldn't pay that penalty?
That's right. So while you're employed here, okay, you have credible coverage. You have great prescription drug coverage here. So it would only be when you decide to retire at that time, at that special enrollment period, if you did not sign up for Part D at that time, then you could be penalized.
That applies to your spouse?
It applies to everybody.
Special enrollment period, if I decide to retire, my spouse would not be hit with a penalty.
Is your spouse over 65?
If she was 65 and she didn't take Part B, and then I'm going to retire maybe how many years from now, there's no penalty.
That's a great question. So it's as long as she had credible coverage. So she's under iPro, she's got credible coverage, she's got her prescription drug coverage. If when you retired, she didn't go down at the time that she was eligible, she would be penalized. If not, you know, if she went right when you retired, then that's what she wanted. As long as she has credible coverage, there's no penalty. Yep.
Now, when should they go down there?
That's right, 90 days.
Right.
Yep.
Thank you. That's exactly what I was going to ask.
Okay, so, and we just talked about this. Yes, what if you're late signing up for Part D? It's increased on every month. So with Part B, it was for every year that you weren't. For Part D, it's every month that you're eligible and didn't sign up. That's right. So you're stuck without coverage.
Until October 15th.
Yeah. Yep. Until January 1st. Yeah.
Yeah. You have to sign up between October 15th.
That's when you sign up, but the actual coverage period begins January 1.
Right.
Yeah.
But what if you decide to retire not within the 3 months prior to the open enrollment?
That's absolutely fine. That's giving you, when you decide to retire, say you wanted to retire in April,
right.
That's giving you a special election period. So that gives you that time because it's a special circumstance for you to make your coverage choices.
So as long as it's 3 months prior.
That's right.
Okay.
When can I enroll in a Medicare Supplement plan? In most states, it's a 6-month window that starts when you turn 65 and enroll in Part B. So remember, Medicare Supplement is different than Medicare Advantage, okay? What if you delay enrollment? You may join any plan. You can't be denied coverage for a pre-existing condition. So I didn't think we talked about that in the last session, but that's really important to know. They cannot charge you a higher premium for a Medicare Advantage plan because you have a special condition. Okay, it doesn't work that way anymore. Important dates and instructions, again, our annual enrollment period is October 15th through December 7th, so you kind of start shopping beginning October 1st. You start to look at the plans and make the decisions based on your needs, based on, you know, your financial situation, and then that's when you're going to fill out an application to enroll. Now you can fill out, you might look at a plan and say, ooh, you know what, October 15th, I really like this plan. And then maybe a couple weeks later, oh no, wait a minute, I think we should go with this plan. You have as many times as you want up until December 7th to make a decision, but after December 7th, that's what your coverage is going to be for one full year beginning January 1st. Okay, and again, this is www.medicare.gov. That's the government website. You can always go on there for information, or, you know, please feel free to contact myself and my team. Again, we can come to your home, we can meet you at the office, you can come to our office, whatever you're comfortable with, you know, for yourself, your spouse, your family, whoever's looking for coverage.
And we have an office in Woodbury.
We do have an office right in Woodbury. Yep. Okay. Any other questions? Does anybody have any other questions? Any other questions on the phone?
It is. It is.
So for anyone who's interested, I do have my card. Again, I would have some of my, you know, you would contact us and some of my team would make an appointment with you to go over your coverages.
Thank you, everybody, for your time today. You're welcome. Thank you so much, Michael. She didn't, hi, how are you? Yeah.